Hi. As of today, March 15th, 2020, it is evident that we are at the beginning stages of this epidemic. Our best advice is to take this situation very seriously. We need to follow the direction of the CDC, the governor, state health department, and our medical providers. The more that we strictly follow the recommendation, the lesser the impact on our community. Just as importantly, we should invest our energies in keeping ourselves and our families safe, rather than focusing on the possibility of this becoming an overwhelming situation. First thing you should know is coronavirus is predominantly spread by droplets. We produce droplets when we are speaking, coughing, or sneezing. Most droplets travel less than 6 feet. Here are the rules we will follow at MetroHealth and that we recommend everyone else follow. We are identifying those who can work from home and will begin this transition as quickly as possible. All businesses should do the same. If you are sick with symptoms of the cold or the flu, stay home and take care of yourself with over-the-counter medication. If you have symptoms of shortness of breath or chest pain or other serious symptoms, you should seek medical care. Please contact your doctor or emergency room before coming in if you can. Stand more than 6 feet away from people who are sick and at least 3 feet from everyone else. For those at high risk, we ask you to be vigilant and stay away from people as much as possible. Wash your hands with soap and water for 20 seconds. This is the most effective way for not getting infected. Hand sanitizers are a good second choice to hand washing. Don't touch your eyes, nose, or mouth. Cough into your elbow or tissue, then wash your hands. It is important, it's critical. We cannot overwhelm the healthcare system. If we do, the spread of infection will become uncontrolled. At MetroHealth, we are postponing most elective visits, procedures, and surgeries. We are also converting as many of our routine and sick visits to telehealth. This is critical to slowing down the spread of the infection and to conserving personal protective equipment, such as masks. Currently, the number of diagnosed cases is on the upswing. There will be a lot more cases as the weeks go by. Once the number of diagnosed cases begins to drop, we will know how long this will last. Look, COVID-19 is different than the SARS outbreak of 2003 or the H1N1 influenza outbreak of 2009. It is also more dangerous than seasonal influenza. Hospitalized patients are sicker and require more intensive care. We currently don't have medication for coronavirus as we do for the flu. Drug companies are working on this, but it will take a little more time. Coronavirus, or COVID-19, is more like the influenza pandemic of 1918. Cities that effectively practiced social distancing early had 80% less cases than cities that implemented it late. Now let's discuss testing. We don't yet have enough available tests because of shortage of reagents and transport media. We expect the number of available tests to increase over the next weeks. As of today, we need to reserve the available tests for hospitalized patients who are critically ill and those who have had direct contact with them. We are also limiting visitation in our hospital. That's another way of limiting exposure of healthcare workers and also the general public. Finally, we know we can overcome this if we follow the guidance of our state health department and medical providers. Remember, stay home, social distance as much as possible, wash your hands, don't touch your face, and be kind to each other. Thank you.